Hello everyone, welcome. My name is Jennifer Price and I'm a student at Mohawk College finishing the Autism Behavioral Sciences Graduate Certificate Program. Today I'll be presenting my final written program. It is a skill acquisition program based on the assessment of basic language and learning skills, which I will be calling ABLLS. The program is based on the ABLLS task in the G domain, task G23, called Labeling by Indicating Yes or No. The client with whom I worked, we'll call him Tommy, is a 6-year-old male with autism spectrum disorder. He began attending Lansdowne Children's Center in November 2013, where he attends for IBI 20 hours a week. He also attends school 2 days a week. He lives with both parents and has 2 older sisters. Tommy has the ability to speak words, but he has little functional language. He does not initiate conversation and often scripts or has one-sided conversations that are sometimes from a TV show, movie, or something someone else has said recently. He uses others primarily as a tool to get what he needs and wants, although he is making some progress in manding, both for reinforcers and sometimes for other items. Tommy does not show items of interest to others, nor demonstrate independent joint attention. Tommy does not engage in simple social games such as rolling a ball to a peer or offer comfort to his peers. Tommy shows many difficulties in adjusting his behavior to suit a social context. He frequently leaves the table during instruction as well as at snack or lunch and will often flop on the floor or cry loudly in any setting, either to avoid a task, gain access to a reinforcer, or for attention. Tommy has difficulty in making friends and has little interest in his peers, as he would prefer to engage in solitary activities. He frequently does not respond to his name when called, turn toward a speaker, or make eye contact. Tommy has many repetitive patterns of behavior, including hand flapping when excited or engaged in a visual stim, toe walking, body tensing, and face grimacing. He also has a very intense preoccupation with opening and closing doors, and occasionally turning lights on and off. His door fascination appears to be a sensory-seeking behavior. He also appears to be sensory-seeking when watching wheels turn on tricycles or a wagon in the gym, as he frequently gets close and watches them spinning very closely and hand flaps while doing so. He occasionally appears to be hypersensitive to loud noises, such as students in other treatment rooms or other unexpected loud noises. He also exhibits an unexpected response to certain auditory input. He becomes very upset and may aggress if anyone around him sings. Tommy does have a fixation with Thomas the Train, Angry Birds, and Henry the Hand. Despite these strong interests, it is often difficult to determine what his high preference reinforcers are, as they vary day to day, sometimes from morning to afternoon. Tommy has a great deal of difficulty with transitioning anywhere, from a treatment room to another setting, or occasionally even from instruction at the table to net on the floor, and frequently will engage in undesirable behavior during these times. When Tommy does have a successful transition between locations, he is reinforced with the use of the iPad. Tommy does exhibit many aggressive and interfering behaviors during the day, although they have been significantly reduced since beginning IBI at Lansdowne, where they were in the 600 or 700s per day. Aggressions include kicking, hitting, and headbutting. He is on a 10-minute DRO to manage his aggressions, which continue to be much lower than at his start, but are not currently consistent from day to day. When he is not aggressive toward others for 10 minutes, Tommy is reinforced with his highest reinforcer, going to the gym. According to Dr. Edward Gary Carr, in his chapter on sign language in Kogel and Rinkover's book, Educating and Understanding Autistic Children, the ability to respond yes or no appropriately is a basic language skill. Typically, developing children would already have developed this skill at a much earlier age. This skill is socially important to developing the ability to converse with others. The methods used in this intervention are ethically and socially acceptable by those involved in the program and to society. Initial ABLLS assessment indicated deficits in most domains, particularly in labeling, interverbals, as well as all other domains from J to X. Tommy has mastered G1, labeling reinforcers, and G47, spontaneous labeling, and has had programming and met some targets in G2, 3, 13, 31, and 42, but has not mastered these according to the ABLLS mastery criteria. His new program focus will be receptive identification under ABLLS-R domain G23, labels by indicating yes, no. The prerequisite skills Tommy has in cooperation and reinforcer effectiveness, receptive language, and labeling are all foundation for development of this new skill. These skill areas may also potentially be naturally increased as a part of this program. Baseline data was taken over 3 sessions by 2 instructor therapists. Tommy was unsuccessful in answering yes or no correctly for all targets on all 3 trials. An example of some of the known targets used in baseline are tree, red, dog, car, and ball. Training has been and will continue to occur both in intensive trial teaching, or ITT, and in natural environment teaching, NET. ITT takes place in a treatment room, with the instructor and child sitting at a table either side by side or across the table. NET may occur in various settings at the center. Teaching will be done in a treatment room so as to be free from distraction, and NET in various settings to help with generalization. Tommy will be shown a picture of the known item and asked the first question without any prompting. Upon answering correctly, he will then be given neutral descriptive praise and asked the second question, concurrently for both yes and no answers, with a full verbal prompt, interspersing with high probability questions as needed. Step 2 of the program will involve giving instruction 2 only, with prompting only as necessary. Prompting hierarchy will be from most to least, starting with a full verbal prompt, then partial verbal, both of which may involve saying, whispering, or mouthing the word, part of the word, or just its initial sound, and eventually moving toward independence, which involves no prompting. Of course, with this particular client, he often moves through programming quickly and may go from a full verbal prompt to no prompt within just a few sessions. Tommy's reinforcement schedule involves use of a token board. He is currently on a fixed ratio of 2, where he earns 2 tokens before receiving a self-selected reinforcer. He typically needs a preference assessment at the start of each session, as he does not have any items that are consistently reinforcing and not being used to assist with transitions or aggressive behavior. All independent correct responses during acquisition trials will be reinforced at a fixed ratio of 1 with a tangible. The instructor therapist will record the prompt level needed for each trial on a session note. This data will then be transferred onto a cold probe data sheet. The highest and most frequently needed prompt for each target at the last session will be recorded on the cold probe data sheet, and the instructor therapist will circle yes or no, indicating whether that was the last prompt level needed at the current trial. The prompt level needed for the current trial will then be marked in the next box for the next session. When there are 3 consecutive sessions at the independent level for a given answer, the item will then go into cold probe. Cold probes that are independently successful will be added to the cumulative target acquisition graph for that week. For this program, yes and no answers will both be tracked. Generalization in this program will incidentally be accomplished by training SD2 across multiple different items, concurrently for both yes and no answers. The actual generalization step will use actual items as opposed to pictures of items, common items in his environment at home with his parents and around the Lansdowne by novel instructor therapists. Maintenance will follow the same procedure as in generalization. Initially mastered targets will run for 3 correct consecutive days, then 3 correct consecutive weeks, and finally 3 correct consecutive months. There were a number of programs encountered in the implementation of this program which I'd like to address here. As mentioned earlier, Tommy's interfering and maladaptive behaviors can affect the number of trials that can be completed for any program, and of course this program was no different. Tommy's DRO for no aggressive behaviors is 10 minutes, and going to the gym is his most consistent, highly preferred reinforcer. This presents a problem due to his difficulties with transitions, which is exacerbated by his door-seeking behavior. This is all very time-consuming. Offering his most consistent second highest reinforcer, the iPad, is one potential solution. Another solution would be to work in a room closer to the gym, therefore reducing the number of doors he comes across during a transition. One method implemented toward the end of placement was to allow him to access a video of the squeaky door he most prefers, opening and closing several times in an attempt to satiate his door-seeking behavior. This has appeared to be moderately successful, but only time will tell. Another problem encountered is that Tommy is highly echoic and would often repeat back the item named in SD2. For example, when asked, "What is it?" he would answer, "Red, no," or "Red, yes." Or, when asked, "Is this red?" for a no question, even with the full verbal prompt, he would echo back red instead of no. One solution would be to skip giving this SD1. Another potential solution would be to incorporate the method in the NEAF 1984 article listed in my references and have him manned for a reinforcer as an SD1 and then give the SD2. Ideally, this program will be continued in teaching trials when Tommy returns from his vacation and be revised after a week to address any continuing problems. Thank you for your time. I hope you enjoyed the presentation. Please consider commenting below.